Hi everyone, today is the first day that we are going to explain innate epidural hematoma and what's the difference between epidural and subdural hematoma. Let's get started. First of all, when we start learning about hematomas and different hematomas, we should know the picture. How can we see it on CT scan? How can we differentiate the two different types of the hematoma? Only by seeing the CT scan image. Only by this you can see the difference. Like in epidural hematoma, it's like this, it's convex, it looks like a lens shaped, or this is orange or lemon, it's like this is the epidural hematoma. We can know it only by seeing the CT scan picture, okay? While when we come to subdural hematoma, it's more like crescent or banana. It's more like crescent, concave, it's not a convex shaped. Okay. The second most important information to know about hematomas, that which artery we got injured. So in epidural hematoma, the middle meningeal artery got injured in epidural hematoma, but in case of subdural hematoma, it's the bridging veins. The bridging veins get injured. Subdural hematoma, it's more common in elderly and alcoholics, like those who take alcohol. And epidural hematoma, it have something very important in the clinical presentation called lucid interval. What is the lucid interval? When in the presentation of the case, he will tell you that the patient fainted for a few minutes, then he regained conscious. This is called the lucid interval, the time that he was not conscious. He was not conscious, so he have lucid interval. We should think immediately about epidural hematoma. There is no lucid interval in subdural hematoma at all. Okay. The most important or third important information, that we should not ever do a lumbar puncture. This is completely wrong. We shouldn't do any lumbar puncture in a patient having a hematoma, epidural or subdural hematoma. We should never do a lumbar puncture, because if we did a lumbar puncture, this will lead to increased intracranial pressure, and this will lead to herniation, brain herniation. Okay, the treatment for both types is evacuation. We will just remove the collection of blood. Okay, things to reduce the intracranial pressure. First one is elevate the head. We will elevate the bed of the patient or ask him to elevate his head. The second one, which is the most very fast one, is hyperventilate. We will ask the patient to hyperventilate. CO2, when the CO2 goes down, decrease, this will lead to vasoconstriction. Vasoconstriction will lead to increased intracranial pressure. The third drug that we can give is mannitol. This is the most important information about the main difference between epidural or subdural hematoma. Okay, bye bye, see you next video.